Welcome to DEMOCREPUBLIX, where we cover the real news that matters to we the people. And the latest reminder that COVID vaccines might not be as protective as the highly publicized Phase 3 trial data suggests. A local ABC News affiliate station in San Diego just reported that a nurse who received the Pfizer-BioNTech COVID-19 vaccine came down with the virus 8 days later. This isn't unprecedented. Data from the Phase 3 trials indicated that it could take up to 2 weeks to develop protections from the virus after receiving the shot. Still, with so much about the process unknown, the incident deserves more scrutiny. And according to the report, local health experts are weighing in. In a Facebook message posted on December 18, Matthew W., an ER nurse at 2 different local hospitals, talked about receiving the Pfizer vaccine that day. He told ABC 10 News his arm was sore for a day, but he suffered no other side effects. 6 days later on Christmas Eve, after working a shift in the COVID-19 unit, Matthew became sick. He got the chills and later came down with muscle aches and fatigue. The day after Christmas, he went to a drive-up hospital testing site and tested positive for COVID-19. The report makes a point of emphasizing the fact that this development is not unexpected at all, and that it's likely at least some nurses will be infected with the virus either just before or just after receiving their first dose of the vaccine during the post-jab incubation period. It's not unexpected at all. If you work through the numbers, this is exactly what we'd expect to happen if someone was exposed, said Dr. Christian Ramers, an infectious disease specialist with Family Health Centers of San Diego. He serves on the clinical advisory panel for the county's vaccine rollout. He points out, it is possible Matthew was infected before receiving the vaccine, as the incubation period may be as much as 2 weeks. Dr. Ramers says if Matthew did contract it after the vaccine, it's still in line with what we know. We know from the vaccine clinical trials that it's going to take about 10 to 14 days for you to start to develop protection from the vaccine, said Dr. Ramers. The doctor then estimated that the first dose of the Pfizer vaccine could deliver protection that's somewhere around 50%. Dr. Ramers says he knows of several other local cases where healthcare workers became infected around the time they received the vaccine. He says all the cases illustrate the fact that results aren't immediate. Even after you start receiving some protection, it won't be full protection. That first dose we think gives you somewhere around 50%, and you need that second dose to get up to 95%, said Dr. Ramers. Dr. Ramers says Matthew's story also shows that even with vaccines, the pandemic isn't going to turn around instantly. You hear health practitioners being very optimistic about it being the beginning of the end, but it's going to be a slow roll, weeks to months as we roll out the vaccine, said Dr. Ramers. He adds this case is a good reminder of why masks, hand washing, and other COVID protocols are important even after receiving the vaccine. Matthew says he's feeling better since his symptoms peaked on Christmas Day, but still feels fatigue. Of course, a top WHO scientist recently warned that people shouldn't stop social distancing and wearing masks after receiving the vaccine. After all, as she added, the trial data tells us nothing about the vaccine's impact on viral transmission. Let us know what you think. Leave your comments down below. Like, share and subscribe. And check out DEMOCREPUBLIX.com for the latest in news. Until next time.
We live in a really nightmare. We live in a really nightmare.